All right, this lecture is going to be a nice short one. This one will be on the penile disorders. So what we'll talk about the three different, I guess it's four technically, penile disorders, and then I'll also talk about penile cancer. Okay. So for the penile disorders, there's four that your book talks about. One of them is called Peyronie's disease. And with this one, this is where the penis is curved due to fibrous bands. Okay, so the fibrous bands are curved in shape rather than straight as they should be. So treatment for this is typically done with vitamin E. They can sometimes prescribe colchicine, maybe some potassium, and then surgery for people that don't respond to medications. Or they can even sometimes do injections into the scar tissue to help relax the scar tissue and hopefully straighten out the fibrous bands. Priapism, we've talked about this in other aspects of this semester. We've talked about it in terms of individuals who abuse erectile dysfunction medications. You'll also see this sometimes with, I think we talked about it in sickle cell, for example, during a sickle cell crisis. And what we're looking at here, this is a prolonged painful erection. And what they mean by prolonged is anything greater than 4 hours. So to alleviate this, you can utilize ice packs. Sometimes sedatives will work. Analgesics that will help relax the area. You can sometimes do injections. Sometimes irrigation will work. But last ditch effort, and I know we have talked about this in class, is needle aspiration. So they'll actually inject a needle into the penis and remove the blood that is causing the erection. So that's usually last ditch effort of what we'll do, but that is secondary to usually erectile dysfunction medications, or again, it could be a symptom or a side effect of an individual in sickle cell crisis. The last two we're going to talk about, we've got phimosis, and then you have paraphimosis. And one of them, they're both having issues where the foreskin is not retractable. One, the foreskin does not retract at all. The other one, the foreskin does retract, but you can't put it back into its original state. So for both of these, care is pretty much the same. We look at antibiotics, warm water soaks to relax the area. And then a lot of times as healthcare providers, circumcision is recommended because, if the skin doesn't retract, we're not able to get the area as clean as it needs to be. And if it retracts but doesn't go back to its original state, then we're dealing with, could be areas of tissue necrosis if we don't get it fixed. So circumcision is going to be the recommendation if there's continued issues with this. The last topic in this lecture is going to be cancer of the penis. Risk factors for this is individuals not circumcised as a baby, and then human papillomavirus. So, we talk a lot about human papillomavirus for females, but we know that men can be carriers of it, and one of the consequences of the HPV is penile cancer. So, what this looks like, it will start as like a small wart, like what you would see with HPV. There will be an area of induration or a red area, and so that would be something that needs to be evaluated by a healthcare provider. Therapeutic interventions are just like for our other types of cancers. We're talking surgery, radiation, chemotherapy. And so there is a high correlation with uterine cervical cancer because, again, it is caused by the HPV, which is the causative problem for cervical cancer. So again, therapeutic interventions is, a lot of times we'll do radiation to shrink down the tumor, and then chemotherapy, widespread, especially if we're dealing with metastasis, and surgery to remove as much of the tumor as possible. Okay, and that is going to wrap up the penile disorders.